Hello to all our dedicated audience. Greetings, colleagues from Unlimited Senior Solutions, Louis Polias, and my team. Here we continue together to prove that we can. We want to share information about AHCA regulatory agency with statements of July 20th. It deals with certain points of utmost importance for our operation. Our intention is to share essential points, but you can go to the agency's website for more additional information. What is important to know about this release? Admission of residents with positive COVID. Unless your facility is under AHCA moratorium, the agency clarifies that we can admit positive COVID residents as long as positive residents are adequately isolated in accordance with the guidelines of the Disease Control Center. You cannot admit a positive resident if you do not have the ability to isolate and or appoint staff to serve you. Now, how do we do with a resident who tests positive for coronavirus in our community? Well, you should transfer him to a designated isolation center or hospital if requires. In previous announcements, we had declared that the state had dedicated isolation centers solely for the state, one of them being the name of Miami Care Center, located at 5959 Northwest 7th Street. Zip code is 33126. Their telephone number is 786-646-3000. 786-646-3000. You are required to give prior notice about the resident containing COVID status prior to transfer. It is critical you establish a protocol to transfer residents to your facility to both the hospital and an isolation facility. It serves to prevent the spread of COVID-19 and facilitate the coordination of necessary care. These centers accept residents directly from ALFs and do not require hospitalization. The intention of these centers is to minimize disproportionate admissions to hospitals. Hospital beds are full of patients who need and require to be quarantined. And what if a resident tests positive but has already left the quarantined area and you're retested? Once a person who is COVID-19 is determined to have recovered and remains asymptomatic, continued testing of COVID-19 may continue to show positive results even though the person no longer is able to spread the virus, parentheses, being contagious. For this reason, it is not recommended to continue to reassess positive residents after they have been medically discharged for COVID-19. For more information on this, please go to the CDC website. You shall find a link which will state duration of isolation and precautions for adults with COVID-19. On the other hand, the health department will be visiting our communities. The main objective of these visits is to evaluate our implementation of infection control protocols and document any unmet need for protective equipment. The department will use data collected from all these assessments to provide personal protective equipment assistance and to educate us. These evaluations will begin on July 21st and will continue until the evaluation is completed to all assisted living facilities. Each visit shall last between 30 to 60 minutes. Visitors must wear identification and wear the appropriate PPE before entering the facility. And let's now talk about the tests to the staff. We continue talking about COVID-19 tests to assist our personnel. Previously, positive staff is extremely exempt from biweekly testing if they can provide medical recovery documentation. And continuing with this theme, second round test kits were mailed by Monday, July 20th. These kits shall allow staff to test for 2 more biweekly cycles. As facilities receive test results from home staff, make sure to monitor the results on the Curative Labs portal several times a day. If any member tests positive, it is essential that you immediately remove the staff member from your facility, obtain a substitute, and report positive cases to the county health department. There are a few more points that we will communicate in our next installment. Please go to the agency's website for more information. Please keep on doing what we're doing for our residents and our staff. We know the work is hard, but we also know that together we can.